Hello, a very good evening, everyone. I'm Dr. Ruhi Agarwala. Thank you for joining us today. So we'll just wait for another 1 or 2 minutes for others to join in. In the meantime, do let us know in the chat. I know we have already, some of you have already submitted your questions for us today. So if you have any more questions, leave it in the chat, or if anyone was not able to submit the form earlier, let us know in the chat. So, okay. So we will get started, and I will take questions from the form submissions that all of you have done. So yeah, again, just to introduce myself, I'm Dr. Ruhi Agarwala, and I have Dr. Ashwani Garg. We both are co-founders of Functional Medicine Clinic. And the whole idea of starting Functional Medicine Clinic was to help people understand the root causes of their health problems and reverse their health issues. So we both come from a conventional medicine background. So we know how the conventional medicine works. And we didn't want to continue further with it because it was not really giving us the satisfaction we wanted to achieve in helping patients, and that's where we found our calling in functional medicine. So I will start with the first question, which Dr. Chaitanya had submitted. Is it possible to stop the disease progression through functional medicine? Dr. Ashwini, you want to answer this?
Right. Thank you, Dr. Ruhi. So, now in the conventional system, it is still as per the medical books. When we read that, also when we were in the school, and maybe the new doctors also will read the same thing. The day we are born, we start getting a disease. Okay, that is how the convention thought process. That is why it is very, very difficult to comprehend that we cannot get away with the disease, because most of us are trained in that certain way. Okay, but in reality, this human body has a design for health only. We are meant to be here for 85 years, 90 years. Somebody lucky can go up to 100 years. Somebody unlucky can pass before that also, but not necessarily that it has to be because of the disease. That is the design of the human body. Now, this design, if it has to function the way it should be functioning, we just has to create the best conditions. As per the latest research and the data coming out, it's no more about genetics. It's more about epigenetics. Now, genes will remain constant. Epigenetics, which is phenotype, which is the environment, is a thing which is very, very variable. What kind of lighting we keep under, what kind of water we drink, what kind of food we have, what kind of microbiota we have, what kind of toxicity, deficiencies, nutrition our body has. All that is going to decide whether our gene is going to manifest disease or manifest health. So to answer Dr. Chaitanya's question, if we change our epigenetics to a healthy epigenetics, which this human design needs, certainly it is possible.
Yes, and then many times we get questions like, okay, is it possible for Hashimoto? Is it possible for chronic lung disease? Or is it possible for chronic kidney disease? Or is it possible for autism, right? So often we are faced with the question that, okay, will functional medicine work with this specific health problem, right? So now would the process be different every time?
Right. So still, even in functional medicine, we are not able to figure out why different people will get different diseases. But when we work with variety of conditions, we look at root cause remains similar in different people, but they have manifested. Somebody has autism, somebody has kidney, somebody has diabetes, somebody has Hashimoto's or psoriasis. Okay. Majority of the root causes remain similar, right? So we don't need to worry what is the manifestation. We just has to make the corrections so that this human design, which is an intelligent design, can work the way it should be working. Now, as a consequence, if disease has come, you can make the disease regress away without worrying what is the label to start with.
Right. So the underlying issue is high inflammation in the body. And this high inflammation can manifest in various ways in different individuals. For example, in me, it may manifest, I'm just taking an example. For me, it may manifest as a thyroid disorder or a Hashimoto condition. In the other individual, it may manifest as, metabolic dysfunction. In some other, it can manifest as some other autoimmune condition. But when we look at what's really going on in the body, there is high inflammation, which is resulting from various root causes.
Yes.
So let's move on to the next question. Is it possible to permanently cure the condition or permanently treat the condition with the functional medicine approach?
So this is a you know just a misconception that nothing is permanent in this world. Let's be very very clear about this. Okay, it's just like we buy a new car. Car will only do performance till we maintain the car. The moment we stop maintaining the car, even if the best of the car, best of the engine, best of the genetics about the car, you don't maintain, it'll break down, it'll not perform the way it should be performing. So if disease is there, you can get rid of the disease. And if you maintain your health. If you're healthy, you can maintain your health without getting into disease as long as you maintain your health. They follow the right rules set by the nature. Nothing is permanent. And no, there is no per se that permanent diabetes cure, permanent this cure. You can get rid of that. Your markers will become normal. It's your duty after that to maintain that. If you maintain that with set rules, it's fantastic.
Yeah, and when we talk about recovery, right, we are talking about improvement in the clinical symptoms that you have been presenting, improvement in the markers in your reports. So, over a period of time, as you implement what your body needs, and if you see an improvement in your markers, you see an improvement in your health, in your sign and symptoms, that's recovery for you, right? You don't have to wait, okay, this has to be completely gone, only then I will consider that my health issues have gone. So that's not how it works. If what you have been struggling with, if you see a significant improvement in your health issues, that's recovery. And to maintain that, to keep your health in that state of health, you will have to provide the body all that right conditions. So let's move on to the to another question. Um, Autoimmunity, now very common these days. Earlier we would see its presentation in when someone is in their 40s or so, but today we see in younger age group as well. So and different people present with different autoimmune conditions. So how can functional medicine address autoimmune conditions and help in in the recovery?
Right. So conventionally, still it is considered as an incurable problem. Now, because conventional system is meant for an emergency medicine, conventional system is always trying to give you a symptomatic relief. That is why there's a confusion that once somebody has an autoimmune problem, it cannot be recovered. Simply because There's no effort put in that direction. Now, body is a smart system. It's not a, it's a ever evolving, very, very smart system. Our immune system is there to protect us, not to attack us. Now, if we have done something wrong with our own self, that is the reason where our own immune system is attacking, right? As long as we start working on the fundamentals, the specific reasons why our immune system start attacking our own self. For example, as simple as diet, inflammatory diet, where food could be hybrid. Gluten is hybrid. We humans have changed the genetics of that. Soya could be genetic hybrid. Now, when we take any hybrid protein in our body and we are not able to digest into amino acids, it will react. Immune system will think it's as a foreign body, it will react. Our immune system is controlled by the microbiota, which is lining the gut. Now, if somebody has a lot of gut problems, IBS, IBD, GERD, bloating, constipation, means gut health is compromised. This also indirectly we can say the gut microbiota is compromised. If gut microbiota compromised, in simple terms, we can say the more unhealthy microbes, pathogenic microbes, could be parasitic, could be fungal, could be various bacterial species, could be various pathogenic viral species, and we are missing on healthy guys, healthy probiotics. Now, this imbalance will also trigger the immune system to do a self attack. If body has deposits of heavy metals in tissues, body has deposits of the heavy metals. Now, for immune system, it is a foreign body, foreign thing that is lying in as a heavy metal in the tissues. Body will react. If our cells, our tissues are infected with infections, chronic infections, the major reason, a major driver behind your autoimmune problems. So if cells are infected with infection, that will also lead to biomimicry and lead to autoimmunity. If our body is deficit in nutrition, so we are constantly remaking ourselves. Old cells will go, new cells will come. Now, if my body is deficit, I will not replace my old cells with the new cells. Now, old cells, non-functional cells, which is called senescent cells, immune system want to get rid of them, but we are not able to replace them. That also will drive up the autoimmunity. So as long as we are willing to work, we're willing to know those fundamental problems in the body, which is driving up the inflammation, driving up the autoimmunity, we start fixing this. And all the time we see, all the time, yes, it can take 9 months, 1 year to completely bring those autoantibody to a level where it is, not a problem. But as you slowly, gradually make your body healthy, these markers will start dropping step by step, step by step.
Yes, and this stands true for any autoimmune condition. The name can be different, but it's an autoimmune condition. So it doesn't matter if you have Hashimoto, ankylosing spondylitis, you have Graves' disease, or rheumatoid, psoriasis, urticaria, eczema, the approach has to be the same. You have to look for what is contributing to these to high inflammation, to to this autoimmune process in the body, and then address it with a holistic approach. Now, when we start working on any client who has autoimmune condition, uh, there is a question: how long do I need to follow this diet? How long, how long I need to take the supplements? Well, if you see, the other option that's there is pills for life, right? You never question how for how long you have to take those medications. It's like by default those medications are for life. So then why are we questioning how long do we have to be on a healthy diet? That's what our body is supposed to be, to be receiving. But unfortunately, at times our body does become a dumping ground for all kind of junk, toxins, etc. So in a way, that question is for yourself, for any individual to think about, is it's a choice that I have to make between medications for life or a healthy lifestyle where I am on a healthy diet. I am changing my lifestyle, which will make my body conducive for healing. And I need to take supplements for a certain period of time until my body recovers.
So let's this is
Yeah.
a very good point that you made. Let's say drugs make you feel great and you have to take it for life. It's fine, but it is not happening. You keep taking drugs, but your problem is not going away. That's the worst part, right? For example, somebody in their young 30s get diabetes. Diabetes means your blood sugars are going up. Hmm? Now, what are the reasons of blood sugars going up? Nobody bothers about. Your blood sugars are going up. First line of treatment is metformin. Second line of treatment is metformin plus a drug which will increase your insulin. So basically, they squeeze out more insulin out of your pancreas. Third drug is somehow puncturing your kidneys so that sugars are going out in the urine. Next line of treatment on the top of that is insulin. Now, as the disease will progress in the body, more and more drugs will come to your regime, but you're not getting away from the disease. You are still miserable. You're still on a very, very accelerated path of unwellness, right? So it's important. This body is meant for eating healthy food. It's meant for keeping it clean, detoxed. Okay. Now, please don't you're doing it for yourself, not doing for anybody else. If you want wellness, if you want health for yourself, if you want high energy for yourself, if you want that you grow old as a young person, you have to do what is necessary required by this body. Okay. If drugs would solve the problem, please happily do, but it's not happening. That is the unfortunate side of it.
Yeah, now coming to thyroid disorders in specific, there are a couple of questions on thyroid disorders that, an individual has mentioned that she's struggling with thyroid condition. So how can it be reversed?
Okay.
I'm sure anybody who has been diagnosed with a thyroid disorder has been taking pills by default without even thinking whether it's helping or not. It's just become a part of your life.
Right. So I think first of all, let's define what is the problem. Okay. Conventionally, if your TSH is going high, TSH is more than 5, more than 7, you're just diagnosed as hypothyroid. Now, how do we know your gland is functioning or hypofunctioning? It's the amount of the hormone produced by the gland would decide whether you're hypo or not. Major hormone produced by the gland is T4. Now, if your T4 is low, then one caveat, you are hypo, if at all. And lot of cases we see only TSH is high, T3, T4 are okay. Now, technically, you are not hypothyroid and you don't need a drug, first of all. Second, we have to understand, even if T4 is low, not necessarily there's something wrong with the gland. It's simply a metabolic condition in the body where your mitochondria is compromised, not able to handle so much of thyroid hormone produced by the gland. The body, as a protective mechanism, will reduce your T4 production. Not that gland is bad. It's a protective mechanism. Let's say my car engine is broken. Will I accelerate it faster or I'll slow it down till I take it to mechanic? Right. So again, in that case, all no, not necessarily you are really hypo. It just if I'm stressed out for some reason, my body will shut down my metabolism or lower down my metabolism. As a consequence, my thyroid gland will also reduce the production. It's a dynamic situation. Okay. Now, if really somebody is hypo, fine. If you need a hormone, you take it. Second, like I said, it's only TSH is high majority cases. T4, T3 remains okay. Now that's a case where thyroid antibodies are high. Now this is not hypothyroidism. It is autoimmune thyroiditis. It's not hypo yet. Then we have to work on the autoimmune part of it. Again, your thyroxine pill does not fix your autoimmunity. It's only bringing your TSH down. That's it. And a lot of cases we again have seen on the pill, you might feel worse also, or you don't feel better because problem is something else and we are trying to do something else. So if you are stressed out, there's every possibility your thyroid gland will come back to normalcy. This is just a simple thing. If your only TSH is high because you have autoimmunity, we can fix your autoimmunity. TSH will come down, right? Next is if actually hypothyroidism is there where T4 production is slowed down, that could be because of the various reasons. And one of the reasons could be simply nutritional deficiencies. This gland also needs certain raw materials to make the hormone, B complex, magnesium, zinc, omega, iodine, tyrosine as amino acid. So if any of these things are low, how will this gland make the hormone? If somebody is insulin resistant, body will bring it down. Not that gland is bad. So it has to be clinically evaluated. It has to be evaluated through biomarkers. Then a right decision has to be made, and recovery is possible. In most cases, until unless your gland is really destroyed for a longest period of time, then you might need extra support. But in young people, there is every possibility because just like any other part of the body will recover, regenerate, thyroid gland will also recover and regenerate.
Yeah, and just to summarize that, so the most common reasons um, why your thyroid, why your thyroid levels may be off the limits. The first is, are you giving your body all the raw ingredients that the thyroid gland needs to make the hormone? Even let's say it has made the hormone, is it able to convert to the active form which can actually do its work on the target organ? So that conversion is very important, and so many nutrition, your lifestyle, that is responsible for the conversion of T4 to T3. And then, of course, you look for the autoimmune trigger. Is there autoimmunity involved? You look for the mitochondrial function. Probably your mitochondria has slowed down, and that's why your thyroid gland decided to slow down. But you are still giving a thyroid pill, trying to, just keep running. And over a period of time, it will just exhaust. So there's a question in the chat. Samantha is asking, can thyroid antibodies, which are very high, like 200 plus, be brought down? So Samantha, 200 plus, I would say is still, it's high, but there are cases where the antibodies is above 1,000. So I'll talk about a case. So that was a case of Hashimoto, SIBO, um, food allergies, really sensitive body, and struggling to conceive, right? And over a period of 9 months, 6 to 9 months, we were able to bring down the thyroid antibodies significantly low. She was able to tolerate foods. Earlier, it was even difficult for her to tolerate vegetables, grains. It was just difficult. Forget gluten and everything was already out. Even the non-inflammatory grains were difficult to digest. The vegetables were difficult to digest. All that improved as we improved the gut microbiome. We cleaned up the body of the infections. We nourished the body, and she naturally conceived after, I think, correct me, Dr. Ashwini, was it after 6 months that she conceived? Yeah, 6 to 7 months.
9 months, between 6 to 9 months,
Yeah,
you
between
can.
6 to 9 months, she conceived naturally. She was 42, and before that, she had various failed IVFs. She was not able to conceive, and she conceived naturally when her body got the right environment. So that's the beauty of the body. You give the body the condition, you make it. The body will make it happen. So, okay, now there are questions about gut health. So let's talk a bit about um, gut health and how to sustain the gut health after, let's say, working with functional medicine for 3 or 6 months.
Right. So let's understand what is damaging the gut health, first of all. How do we end up having a problem in the first place? Now, we need enough stomach acid, we need enough digestive enzymes produced by the gut, we need healthy microbiota to digest. This is typically things that are required for the system. Now, a lot of people have a lot of gut problems after overdosing of antibiotics. When you take multiple shots of antibiotics, you wipe out the healthy colonies of the microbes. You grow a lot of fungal infection, yeast infection, and Clostridia infection. That is one of the starting phase. Second could be this body is meant to be eating something else. You're eating something else, right? This microbiota needs a lot of fiber. A diverse fiber we feed, diverse microbes will grow and they will keep us healthy, vibrant, and our digestive health will be at best. Now, you're only eating refined foods, only eating white rice, right? Or no, you're not diversifying your diet, not enough fibers, variety of fibers. Then also your gut health will get down. Lot of time, major misconception now about if somebody has a burning sensation in the stomach or there's a reflux, it is told is a high stomach acid, let us take antacids. Now, if you really there's no evidence to prove that stomach acid has increased. Now, as we age, this is the fact that our stomach acid production will reduce, not increase. It's only the problem is if whatever stomach acid, if it remains in the stomach, it's fine. But if we regurgitate, it comes back to the esophagus where it makes you feel burn because the stomach acid should not be there. Now, why it is regurgitating? If you are stressed out, for example, your metabolism is down, your digestion is down, you eat some excess meal, it will not get digested, the upper sphincter will not close down, lower sphincter will not open, the food will not go down, it will regurgitate, it will give you burn, you start antacids, and this is the beginning of your downfall. Okay, so this is some of the, or your food has a lot of pesticides, it will eliminate your good microbes. So once you stabilize yourself, once you get better with the right strategies, then you keep doing those right strategies. Not necessarily you have to take supplements. You don't necessarily have to take or buy expensive probiotics all the time. You just has to eat well, get a lot of sun, and read at the right time, eat the right way. This is what we are meant for. Okay, we are not meant to be dependent on things. Like if system is down, you need support. If system is up, you are free. Do the right things. That's all is required.
Yeah, so this answers the question that one of you had submitted. Do we need to keep taking supplements for life? No, you don't have to keep taking it, right? You test whether you need it or not and you take it. So supplements are for a certain period of time as long as the body needs it. If your levels are good, your body is good, then you may have to take it for a maintenance dose for a few weeks. And then you regularly check yourselves, see how your body, your markers are, and you only take if needed, otherwise you don't have to. So now the connection of the gut with anxiety, with depression, with panic attacks. Okay. um how is functional medicine different in addressing anxiety or depression?
Hmm. So first of all, this depression business, okay, this is not just that you're feeling lonely or depression means you don't have enough energy in the body to perform task. You feel so low, you don't like get up, you just want to lie down, you don't want to speak, you don't want to communicate. Basically, your brain cells are not able to produce enough energy for yourself. That is depression. Now, if you upgrade your biology, you improve the mitochondria in the brain cells, your energy production will go up, and your depression will go away. So, in a way, as per the latest science and research, depression is a poor metabolic activity. Just like diabetes is a metabolic disorder, depression is also a metabolic disorder. You upgrade your brain health, your depression will go away. As simple as your energy production will go up. That's all that you need. Now, how it is connected to your anxiety. Now, a lot of time we see if there are fungal infections, clostridium infections, parasitic infections in the gut, and these guys will keep producing a lot of toxic waste, will poison the brain or alter the neurotransmitters of the brain, which is causing you anxiety, etc. If you clean out these infections, you stabilize your immune system. Toxicities produced by these infections affecting the neurotransmitters in the brain will be reduced. You can get out of the OCD and your uh, anxieties and all that. But then is there's no way that you can only make this brain healthy, rest of the body can be unwell. It doesn't work like that. Either this complete body is healthy, gut is healthy, brain is also healthy. Or if gut becomes bad, slowly, gradually, brain will become bad. So if this has to, brain has to get better, the other parts of the body as a down, this is downstream, last thing. Okay, on the this thing. If in basics are right, brain will also function better.
Yeah, so that's the answer to the question posted by Mr. Suresh. So, what is happening in the gut does not only remain in the gut, it is affecting the entire body, and it is also affecting our brain, causing depression, causing anxiety. So, if we have to treat that, we have to look at the whole body. We have to look at what is happening in your gut because the neurotransmitters are made in the gut. So, with a whole body approach, it is possible to, get rid of symptoms manifested in the brain. So, coming to autism, okay. Now, what is the functional medicine approach to autism?
Right. So generally, by definition, autism is repetitive behavior, speech is a problem, socialization is a problem. Now, there's no pill for the disease or there's no pill for the diagnosis. But if we break down the problem into small, small pieces and we start solving one piece by one piece, then things will get better. Things or disease will start regressing. Let's say one common issue that parents say, my child does not speak, or he can utter words, he cannot communicate. That's a common problem. And they only want speech. Rest of the body has a problem. Sometimes they forget about it. It is not going to happen. Now, let's say this brain has to communicate my thought, and I have to use my tongue and muscles to produce voice. This brain, this central processing unit has to be healthy. Then I should be able to coordinate my muscles to produce a words, right? I have to make this brain healthy. That's all I can do, and this is possible. If this brain becomes healthy, my speech will also come naturally as a consequence. Okay. In most majority cases, we have, you know, uh, non-verbal, completely utter, they were not even muted children has started speaking, communicating, all that is happening. But it's not as simple as it looks. You cannot simply make this brain healthy. Before you make this brain healthy, you have to make this body healthy. All the toxicities has to be removed. Infections has to be brought down. You have to nourish this body. This brain cells are so concentrated. Okay. It's just like you buy a mobile phone of 250 GB. You have to make it 1 GB. As natural, how much cells should be there. You have to improve neurogenesis and synaptogenesis by creating the best of the conditions. You do that, this brain will get upgraded and start doing the function it is supposed to be doing.
यस सो नाजिया, आपका जो क्वेश्चन था कि स्पीच डिले में कैसे काम करेगा फंक्शनल मेडिसिन, सो दैट्स व्हाट डॉक्टर अश्विनी जस्ट एक्सप्लेन्ड. इट्स कई सारे फैक्टर्स हैं विच प्ले अ रोल. सो बच्चा हो सकता है सिर्फ आपका फोकस है कि द बच्चा बोल नहीं रहा है, बट दैट्स नॉट जस्ट द ओनली इशू इन द चाइल्ड. there are a lot other things at play. तो उन सबको एड्रेस करना पड़ेगा. जैसे 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 बॉडी हील होगा, the speech will also come. And yeah, as Dr. Ashwini said, we have seen this in so many children, completely non-verbal children. Uh, they started with few words, they started speaking few sentences, and now they're able to make conversation. Okay, so everything has to go through a process, and patience is, of course, the key, and consistent effort is required. And with that, recovery is definitely possible. Okay, let's talk about hormonal imbalance. Now we have questions here regarding fibroadenomas. We had submissions on endometriosis, uterine fibroids. Now, often one easy solution is to just remove the lump, remove the fibroids, or go on a hormonal pill. Is that the way how any hormonal imbalance should be addressed?
So it's like there's one problem. To suppress that problem, you add another problem. For some reason, your hormones are out of balance. For example, lot of time fibroadenomas and breast lumps are due to estrogen dominance. Now, it's not that estrogen production has gone up in the body. It just either estrogen elimination is not happening, or metabolism of estrogen produced by the body is not happening because liver is compromised, or we are taking lot of food products or from the environment which mimic like estrogen. It's not actually estrogen mimicking, like for example, dairy products could have hormones of the animals. Microplastics can mimic like estrogens. Hybrid soya could be a big problem. So many factors which affect and start mimicking like estrogen, and estrogen presence becomes high, and it's start leading to adenomas and all of fibroids and all of that. Now, to counteract, you start adding another hormone from outside. It's already bad, we do another bad. Okay, so really has to fix what is not right there. That is a sustainable way. Temporarily you might feel okay. That is why we call it emergency medicine. Okay? Temporarily it'll make you feel okay, but this life is spent for, let's say, 80 years, 90 years. You might feel okay on hormones for another 5 7 years. After that, things will go very haywire, even more difficult to fix.
Yeah.
So you really has to go the right way.
Right. So coming to Shreya's question, now if you have fibroadenoma, you remove the fibroadenoma, but you have not done anything about what had contributed to fibroadenoma in your breast. Now, what had contributed to fibroadenoma in the breast can also create masses or fibroids in the uterus. It can also create lumps somewhere else, outside the uterus. It can contribute to endometriosis, adenomyosis. So you've just removed something that had grown out of control, but you've not done anything about what had contributed to that process. You've not done anything about how healthy your liver is. You haven't removed any of those sources of xenoestrogens. You haven't worked on the elimination system of your body. So until all that is done, we cannot expect other consequences of what had really contributed to hormonal imbalance in the first place. Now, whether functional medicine can help in get rid of the fibroadenomas, now understand that first the effort would be to identify the triggers. Okay, remove the triggers, um, stop the progression of the condition. Okay, and once because if the disease is progressing, the focus has to be on the progression of the condition. And once the progression has stopped, right, eventually it will start regressing. Now, why is a breast pain? The breast pain is because it is pressing on the other neighboring tissues. That's why the breast pain. Okay. So over a period of time, as it starts regressing, the breast pain will also go away. And it's also because of the inflammation in the body. Um, okay. So let's talk about hypertension, diabetes. And let's hypertension. We have someone who said struggling with severe hypertension. What is the approach again? What is the functional medicine approach to hypertension?
Right. So, what is hypertension? Your vessels have become more brittle because of inflammation. The vessels has calcified, they have become more brittle. They're not able to hold that pressure ideally they would be holding. That is hypertension. Now, various factors, inflammatory triggers, which can make this go haywire. Lack of magnesium can also make this vessels brittle. Insulin resistance, which is a poor metabolic function, can also make these vessels more brittle. Okay. Now, if we reduce your inflammation, we decalcify your vessels, we feed you enough magnesium, we uplift your metabolic function, slowly, gradually, the brittleness will go away or become less, and you will be able to expand your circumference of the vessel, let's put it that way. And then you can handle, let's say you need a higher supply of blood to one particular area because you're exercising, then your body will be able to do that. Today it's not able to because the flexibility is lost. You have to regain the flexibility. So certainly it can be, but then don't expect that I give you a pill and it's gone. It's a temporary. Generally you take a calcium channel blockers or other drugs, which you take a drug, it is sort of relaxed and comes back to normal. But we have to bring back the natural phenomena, which can take time. 6 months, 9 months. It's taken care.
Yes, yeah. So it's very much possible to get off the antihypertensive pills once you start addressing what is contributing to high blood pressure in the first place. Um, okay, so there are questions around eczema, urticaria, allergies, dermatitis. Is it possible to get rid of all these and be free of all these allergies, eczema, etc.?
Right. So certainly allergies is like you mentioned that one, so many. Just one, you mentioned that she was allergic to almost everything when she was eating. But today her allergies are pretty much now. One of the reason of allergies is leaky gut or poor diversity of microbiome or poor acid production. Now you eat something, you don't break it down into the, let's say, amino acids. Okay. Your gut is leaky, undigested food get in touch with your immune system and you start reacting to it. A lot of toxic waste goes to the blood where immune system becomes hyper vigilant. Now you reduce bad foods, you reduce hybrid foods, you clean out your infections, you improve the microbiome diversity in the gut, you'll see the leaky gut. Lot of hyperinflation of the immune system will calm down. Then you can stop reacting to sudden weather changes also, because your immune system has calmed down as naturally it should be. But if constant triggers are going on, immune system is always vigilant, then every small thing is a problem, right? Now, eczema, higher form is psoriasis, is again an inflammatory process or autoimmune process. There are also triggers behind it. It is not happening in isolation. Yes, it can happen from the birth also. Probably mother's microbiome was not happy, or very early on, child was given antibiotics. Okay. So whatever the problem is, we has to just pull it out of the body. As a consequence, atopic eczema or dermatitis or psoriasis is taken care of. So many cases we have fixed so far. It's no rocket science. It's very, very straightforward.
Yeah, and understand that, y- you were healthy all this while, right? For 30, 35 years, you had no issues with your skin and everything, but then you started developing it. So something somewhere definitely has gone wrong over the period of time. Of all the conscious, unconscious choices you made for your body. So if we identify what choices had gone wrong, fix them, give the body the right condition, you will see things reversing. Okay. Now, gallstones, right? Most of the time, the moment a gallstone is diagnosed, of course, the person is suffering with pain, and the pain can be very severe also. And often, one of the solution offered is remove the gallstone. Sorry, remove the gallbladder. So, what's your um, insight on this?
Right.
Should the
So first of all,
gallbladder be removed?
first of all, to say that gallbladder is a rudimentary organ and removal has no bad consequences, it's just such a lie. Gallbladder is such an important organ for our own health, for your digestion, for your microbiome, for your detoxification, for concentrating your bile. It's a very, very important organ. Please don't take it lightly. That's a small thing. Sometimes this a lot of patient has come to us. They say, I had some stomach issues. I had some digestion issues. I had some bloating. I went to the doctor. They ultrasound and found gallstones. They removed it. Problem is as it is. Organ is gone. Probably it is gone to worsening. Now, stones are not coming from outside. These are not actual stones. They look like stones, but they're not hard uh, stones per se. These are cholesterol stones. Generally, cholesterol or cholesterol stones, let's put it that way, over a period of time. Now, if you don't take enough fat in your diet, there's hardly any trigger for the gallbladder to squeeze. Then, if gallbladder is not squeezing, then it's a problem, right? So if stagnation is happening because of less triggers, then whatever is there, it starts getting stagnated there, and it forms a stone formation. Now, it's a cholesterol stone. If you take supplement yourself with extra bile, you supplement with bitter herbs for a long enough time, you perform certain exercises where squeeze the liver, squeeze the gallbladder. Okay. uh, Enzymes which systemically work. Now, enzyme you can take for the food, which help you digest your food. But if you take enzymes on empty stomach, it'll go to the system. It start the cleansing process. Now, fat stones, cholesterol stones, can be dissolved by lipase, for example, or bile, for example, or a high level of proteolytic enzymes. Or if they are calcified, you can use certain chelators. They will remove the calcium of the stone. Then you use enzymes to dissolve. So it can take some bit of a time. Eventually, it can be dissolved. It's not so. Yes, but everybody's situation is different. Everybody condition is different. Everybody's extent of the problem could be different. Time frames could be different, but possibilities. So don't take it light that you have some symptom. Let's take it out. That's very, very important. Please preserve. Conservative treatments are more, until it's such emergency. If you need it, you have to do it. Fine. But most of the time, if it is not necessary, keep it and try the conservative treatment.
Yes. So I'll take this question which Dr. Chaitanya has shared. My mother was diagnosed with interstitial lung disease 2 years before, but now we found that she has rheumatoid arthritis too. It could be that it's RA, interstitial lung disease, and the disease is progressing. Is it possible to even reduce the progression of ILD along with RA,
Hmm.
as the lung manifestation is significantly making her everyday life difficult?
So now, Dr. Chaitanya, one thing to understand, any autoimmune problem is just not organ specific. Immune system problems are systemic problems. Now, they can attack joints, we call it psoriasis. They attack the thyroid, we call it Hashimoto. They attack the skin, we call it psoriasis. Depends on where it is attacking, we're keeping it, giving it different names, but it's a problem in the immune system. So it's never localized. Yes, what are the symptom comes first? We test for it, we find those autoantibodies, we label it to. But then, if we don't do anything about it, disease is progressing. You start affecting one organ, then start affecting another organ, and it becomes a multi-systemic problem. That is how usually the story is. Now, if we eliminate the reasons behind the autoimmune process, the damage on the body will come down. If the damage comes down, body goes into repair. So certainly it is possible that you can halt the further deterioration. That is pakka. There's no question in my mind. Now, how much damage is already done, how much fibrosis has happened in the lungs already, that we have to see. But I am still very certain that a decent, comfortable life state can be achieved if we work hard enough on that. These are multifactorial, like I said, infections, toxins, deficiencies. So many, sometimes this autoimmunity is triggered by the vaccinations, which is enough data and research is there. Okay. So as long as we balance the immune system out, things will get settled down and things will get better.
Yes. Um, so often we have seen post-COVID infection or, post-COVID vaccine, after the COVID vaccines, condition has deteriorated for some people. Um, and we have seen this very commonly today, with so many of our clients that their health, they were recovering pretty well, but, it just led to worsening of the condition, whether it's a COVID infections, etc. So we have a question here. What's your take on long COVID inflammation due to spike protein of vaccine manifesting as gut dysbiosis and other autoimmune conditions?
Right. So now, I think there are two kind of vaccines. One is this mRNA vaccine, which is sort of nobody knows for how long these proteins will be produced in the body. Now we know these spike proteins are pretty bad. They will bring up the inflammation. If inflammation is there, then all respiratory symptoms are there. Okay, inflammation of the heart muscles, inflammation could be in the brain fog could be one of the major symptom of that, and other autoimmune problems start, coming up along with it. Now, again, if we reduce overall inflammatory triggers in the system, let's say we clean out the infections, we improve the detox processes, we reduce the inflammatory food, we nourish the body, we stabilize the immune system, then overall health will become much easy. That is one. Now we have been using something called scalar detox to detox the spike proteins. We are doing it in India. We are not able to do it outside India because you know uh, customs and all that doesn't allow these this scalar energy solutions to get out of in their countries. But anybody in India, phenomenal, it is working. We can knock off these things which are producing more spike proteins in the body, so that also can be tackled. But of course, like I said, all of these problems happen over a period of time, and even infections or vaccine induced injuries are only happening in people where the system was already compromised. Healthy people are able to sustain and then still going on with their lives. When your system was already compromised, maybe there was no problem in the first place, but system was compromised, then in those people, symptoms are heavy, problems are heavy. So that way, we have to fix the current problem, and we have to fix what they had been having undiagnosed or under manifested already in the system. But it is possible.
Yes. So coming to this interesting question, what and why are Candida die-off effects? So now, anybody who is working on addressing infections in the body will experience die-off reactions. It's these are the symptoms which come when the infection, when the pathogens die. They release a lot of toxins, they release a lot of histamine, which gives these die of the die of reactions, and they will happen. Dr. Ashwini, you want to add further to this?
Right, right. So when we are, see, just like you and me want to survive, these infections also want to survive, and they have also mechanisms to fight against us also, right? So when we bust them, their byproducts are released, which triggers more histamine and more reactions are happening. Now we can use binders, we can use sodium bicarbonate to alkaline this blood for the easy removal of these toxins so that you can dampen the overall reactions. But if you really has to cleanse yourself, you really has to bring you out of the problem, you can expect these turbulences. But then these are short-term turbulences. Depends on, of course, how big is the problem to start with. If we expect a lot of turbulences or a lot of die-offs, etc., we go slow anyway. Depends on if infections are very heavy, immune system is compromised, will be more reactions. But then there's no easy way to come out of that. You have to go through it to come out of that. So please don't be worried about it. If you just make your mind, I want to get healthy, that's all that is required.
So, do you want to talk about SIBO? There are questions around what would the timeline be for SIBO and etc.
Right. Now, SIBO is small intestinal bacterial overgrowth. Now, this is bacterial overgrowth, but generally it is not limited to bacterial. There's a fungal overgrowth, there's a parasitic overgrowth, there's a viral overgrowth also. It's maybe manifestation is more bloating and GERD and all of these things. But it's again only not bacteria. It's multiple infections. So there's a right sequence of killing these infections. You first start targeting the parasitic infections, fungal infections. Then later you get onto the viral bacterial infections. Okay. Another thing about this is how well is your immune system? Now, there is no way we can completely eliminate any infectious organism from the body or from the environment. It is never going. It is always there. It is your state of the immune system which decide which will be proliferating or which will not be proliferating. Now, you have to bring it down to the level where it is not a problem. Let's say you do one round of rifaximin, you do one round of the antifungals and all that. You might bring it down to some level, but if your immune system is compromised, it'll come back. It'll always come back. You have to do a medical treatment, it'll come back, come back, come back. So it is important that you work upon your immune system also. Now, two major reasons of poor immune system. One is toxicities, heavy metal toxins and microplastics and all of that. Another is deficiencies. Another, immune system has become more autoimmune in nature. So we have to bring that into balance. We have to remove the toxicity. We have to nourish the then we have to build the immune system. Parallelly, we have to do the cleaning. This will bring you a sustainable result. So it can take 6 months, it can 9 months, depends on your starting level of problem.
Yes. So now often, it's so there are so many tests in functional medicine, right? There's so many advanced functional medicine. For example, in our cases, we may not, for the clients coming to us, we may not prescribe all those 8, 9 advanced functional tests. So then the question is, are we able to identify what's really contributing to the problem? Are we able to identify all the root causes with just a detailed blood work, or let's say an organic acid test or a hair sample analysis? We aren't doing the neurotransmitter test, we are not doing the SIBO test, we are not doing a GI mapping.
Right. So again, tests are suggestive. No test is absolute. Now, interestingly, we have found when as a clinician, I know there is a fungal infection, clearly, just in front of my eyes. But test comes out negative. A lot of practitioners say, no, 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 because the test is negative, let's not treat it. Then the problem is not getting better. Hmm? So we have to take the markers and the problems in hand and start working upon that. Some tests are more of a theoretical purpose. As clinicians, we want more evidence, but there's a there's a basic requirement which is good enough for us to solve the problem. On the top of that, if we are able to do more tests, it is good data, and we can do a little more precision also. But then again, we have to see how much is the buying capacity of the client that is working. If you ask me, I can have as much as I can, more data, better this thing. But in majority cases, a detailed blood test and organic test is good enough to work upon the problem. And for example, let's say SIBO. Now you can take a breath test and confirm SIBO is there. Now, if symptoms are there after meal, there's a bloating, there's a fullness after meal, there's a GERD that is there. It's just pretty much in front of my eyes. Why do I have to just confirm with the 20,000-30,000 rupees test for that? If a client wants it, we can certainly do it. There's no problem. Now, SIBO test will not say if it is a CIFO test. CIFO, again, you have to clinically evaluate. Okay. Now, parasitic infection, there's no absolute test, right? These parasites are there in the cells. Even sometimes I do 30,000 rupees of microbiome test, it will say parasites are negative, but symptomatically I'm seeing teeth grinding is there and all of these things are there. It is present, but it is not come positive in a test. So sometimes it is also a problem. You do the test, but it comes negative, but you see the problem. Then the patient says, "My God, I spend money, but you still doing it, not following." So clinically relevance has to be very, very important. Another thing, lot of people say food allergy testing. Okay, now it's such a dynamic thing. Your infections comes down, your leaky gut resolved, a lot of food allergies are taken care. Okay, now sometime, for example, gluten. You do a food allergy test. Uh, only for gluten protein, it says you're negative. But wheat has gliadin also. There are other peptides also. You might be reacting to gliadin, but not to gluten. But then because gluten is negative, the patient will say, no, no, because my test is negative, let me eat it. For example, as per the test, you're not reacting to white rice. But white rice indirectly doing a damage. For example, you take white rice will feed the yeast fungal infection. That yeast fungal infection will drive up your immune system problems. Then test will say no problems to the white rice, but indirectly it is causing a problem. So everything has to be seen in the context. Okay. Yes, if somebody can do, it's fantastic. But we are very, very detailed. Okay, we really look at, if necessary, we'll ask you. We will not shy away from that. But we don't, again, we want to balance out. We don't want to overburn the money from. But every practitioner is different. Every practitioner way is different. So as long as person gets well, is the outcome. That outcome is a must.
Yeah. So for us, if anybody is working with us, we advise 2, 3 investigations. So now, do we need all the reports to start the treatment? Do we have to wait for all the reports and then only start the treatment? So the answer to that is no, you don't have to wait for all the reports. Once you have the detailed blood report, we can get started with the treatment because there is a process to start the treatment. There are onboarding formalities. There we have to take all the sign and symptoms to a detailed history form. So even if you have the detailed blood work done, we can start with the treatment. We can make the uh, first cut of the treatment plan based on the sign and symptoms and the blood markers. Then as the other reports come, we can evaluate that, we can analyze that and add to the existing plan that we have made. And it's not that what we have already made, okay, certain things will be uh, deleted after other investigations done. No. So that has been created based on what the findings were. The additional findings will only help in more data and adding to different components of the treatment plan. So I'll take one or two more questions. So often there is functional medicine evidence based? What is the research around functional medicine? So one question is that what is the scientific evidence?
So there's nothing more evidence-based than functional medicine. For example, we are not shooting in any dark. Okay. We are not in a way only using pharmaceuticals to fix the problem. All we are saying, these are the triggers behind your problem. Let us make your body healthy. As your body becomes healthy, it will take care of the problem. Okay. For example, one question on the psoriasis, can functional medicine. So we will eliminate the reasons which are triggering psoriasis in the body, and body will heal its psoriasis. Okay. We will test very detailed testing we will do. So what more is required when it comes to evidence-based is it's the most evidence-based medicine, if you ask me. We do very detailed. Sometimes people get angry. Why do I need to do? I just have little problem. Why are you doing so much testing? Right. So we gather a lot of data, which is not even looked, by most of the conventional ways of doing things.
Yes. And then, okay, is there a testimonial for, for this particular condition, that whether you have treated this condition? Okay, is there a testimonial for psoriasis, for example, in functional medicine? Is there a testimonial for this condition? Is there a testimonial for that condition? So let's understand that, over the last 1 hour, we have been speaking the same thing. Most of the chronic conditions have an underlying cause. Okay. And the process how disease is developing is pretty much same for any chronic condition. So uh, a testimonial, if there are results in a particular autoimmune condition, it will yield, the approach will yield results in other chronic conditions also, in other autoimmune conditions also.
So there's a question he has asked. Nishant Ulchandani has asked twice. 20% of the healthy people have rheumatoid factor positive. Now, so Nishant, not necessarily the moment the tests are positive, they start having a problem. The first problem starts, then it grows, then it starts doing a damage, then manifestation as a disease will happen, then rheumatoid arthritis will happen. Now we work with autism, an autistic child has heavy ANAs and all that. Not necessarily the joints are affected at this point of time. Okay, so it's a state of inflammation in the body. It's a systemic problem. Okay. So if rheumatoid factor is positive, means autoimmunity is there, does not mean necessarily that they will right away have all the symptoms. It's not always the case. It will happen much later. Any problem comes, start damage, then a manifestation. So if somebody is RH positive, I would say at least remove the triggers and protect your future problems. Or not, stop your future problems.
Yes, and for those who have all the sign and symptoms of RA, let's say, but your RA factor is negative, do not keep chasing, that particular marker which will help you label the disease. Look at the sign and symptoms, look at what your body is trying to tell you, listen to your body. It's already giving you signs that something is off. So it's time to address it rather than waiting for a certain marker to be positive before before starting addressing the problem. Um, okay, so I will allow unmuting and taking one or two questions. Ajay, you can unmute yourself. Ajay, are you there?
Okay, meanwhile, so let me let me anyway address that. Okay. FMT is a great way. It's fantastic. There's no question in my mind about it. But now, microbiota is very, very dynamic. It's never constant. It's very, very dynamic. Now, if your immune system is compromised, you do FMT and it come back to the same bad state also, right? So if you make your immune system better and you anyways do the basic right diet, lifestyle diet and all that, lot of microbiota will get better. If you still need FMT after that for clinical outcomes, you can do that. But let's say you have IBS, you don't want to change your diet, you don't want to clean your deficiencies, you don't want to clean your toxicities, you don't want to work on the immune system strengthening. Then even if you do microbiota transplant for 20, 30, 40 sessions, you are feeling okay for some time, it'll come back. Okay. So it is important, why the problem has come into the body in the first place. Okay. Microbiota controls your immune system, but immune system also has a major role to keep the infections in check. So this is both ways.
All right, doctor. Thank you so much. That was my question.
Thank
Okay.
you, Vijay.
Okay, Anshuman has a question. Is it normal to experience head pressure when there is neuroinflammation, or there can be any other cause of head pressure?
Generally, pressure will have an inflammation component, right? They will be in now again, pressure could be again, some mass could also be there. Then probably in that case, we want to go to a neurologist and get CT scan, MRIs, and all that. But if that is ruled out, then inflammation is there, and then as we remove the inflammation, things will get better.
Yes. So now, is there any age restriction for starting the treatment for autism in children? Ramesh, the answer to that is, of course, the earlier we start, the better it is. But despite that, there is no restriction to the age, what the age of the child should be to start the treatment, right? Even with older children, uh, good improvement is possible. See, what we are trying to do here is we are trying to give the body the right condition. Okay. Give the body the right condition so that it will allow improvement in the symptoms that the spectrum shows. So that's all we are trying to do. Of course, in an older child, time taken would be longer, but improvements are definitely possible.
Now, it's also important for everybody to understand that autism is because of underlying problems. It's not a static problem, it's a dynamic problem. As a child will grow, the problem will also grow. If the problem will grow, behaviors will become worse and worse. It's not a behavioral problem. Behaviors because of the problem is the problem. Okay. So at any stage, doesn't matter, somebody is 20, somebody is 30, some resolution will happen to the progression will stop. If somebody child is 10, 11, it's still a good time, very good time. But at least we stop the progression, stop making it worse, and rather make recovery as much as it is possible. So MRI is, if Anshuman MRI is normal, then inflammation is more likely is the problem, and then we should be able to, in all possibility, help you.
Yeah. So I'll take just one last question. So Lalita had asked how to maintain gut health after doing the treatment with functional medicine. So a part of it we answered earlier. So of course, during the program, we address the infections, we address the deficiencies, we clean off the infections, the toxins, etc. And after the program, definitely it's important to continue the recommended lifestyle and the diet. Keep your diet clean. Keep it be on a non-inflammatory diet. Once in a while, you eat the restricted food. Your body will be able to tolerate it pretty well, but it cannot be an everyday thing. You'll have to keep an eye on that, and keep testing regularly, at least once in 3 months. Once in 3 months is will be good, so that you can see if there is a need for any supplements, probiotics, etc.
Mukund, gastritis is quite simple. In most cases, 3 months is decent enough to bring you out of the symptoms. Okay, but then underlying problem correction might take more longer times. Problem comes, then symptom comes. When we fix it first, symptoms will go, then the problem will go. So symptomatically, 3 months is decent enough to stabilize you. But then again, how much is the problem? How long it is there? What is the depth of the problem? All that will decide.
So, okay, whether the progression can be reduced only with the vegetarian diet. So,
It's not about vegetarian, non-vegetarian, it's about the right choices. Okay. If gluten is vegetarian, it's a problem. White rice is vegetarian, is a problem. Okay. If meat, your digestion is down and you take meat, it's a problem. But if you can digest organic meat, it's fine. Hmm. It's not about you being vegan, vegetarian, or non-vegetarian. It's about what are the choices among that. I am a vegetarian. I still can be okay, not necessarily. A lot of people being vegetarian get into a lot of trouble. So, what is the right thing? Now, fruits otherwise are healthy for a healthy person. In your mother's case, bananas could be one of the problem. Apples, red apples could be one of the problem. Oranges could be one of the problem, right? So we really has to deep dive and see what is there.
Thank you, sir. Thank you so much. But regarding that, like she has multiple problems. So like how to find out that like which food is causing the issue and which food is not? Because whenever she takes something, some or the other complaint she keeps getting. So it's getting very difficult for us to find out which are the foods that is like
Right. So
making her thing
right.
worse.
So then
Yeah.
we have to start with the baseline, which is we
Okay.
remove gluten, we remove white rice, we remove dairy, sugars, refined oils. We start cleaning infections, we start nourishing the body. That is the baseline we have to start with. Then after the baseline is, on the baseline, if something else is troubling, etc., 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 then we can use digestive enzymes, high dose probiotics, etc., to stabilize them. Still not, we can start removing other things also. But let's say baseline white rice is going on, gluten is going in, dairy is going in, refined oils are going in, then everything might be reacting then. So really, we have to start and see, keep looking, keep looking, keep looking. If things are very, very bad, but still, there's a way to progress.
Okay,
At
sir.
least,
Thank you very much. Yeah, thank you for answering my questions. Thank you very much, sir.
thank you, doctor.
okay, we'll take the last question. So, do we need to stop the medications if we are taking the investigations?
Not necessarily, not necessarily.
So, Suchita, you're on immunosuppressants, right? So, yeah, I mean, I'm sure you've been on these medications for some time now. So, you can take the test while you're taking them. That's okay.
In fact, we don't
So,
say you remove your medicines also. Only if your body gets better, need of the drug will become less. Then, in that case, we say, okay, let's start weaning it off. In fact, you can consult your regular doctor also for it. We're only saying let's make body healthy. Need of the drug will coming down. You can consult or we can help whichever way it works. Um, but these drugs will not affect overall evaluation for us. You can continue your drugs and still do your testing. If anything specific, we would mention in the emails that stop this and do that.
Yes.
Excuse me, doctor. I asked for the psoriasis. So, as you said, it can be reversed, and you have to find out the root cause of that, and then you can work on that. How much time it will take to work on that?
Psoriasis, 3 months or 6 months depends on the severity. 3 6 months is decent enough to new lesions will not come, old lesions will start drying. 6 months, a lot of cleaning can happen. Uh,
Okay.
After that, like I said, the symptoms can go away, but problem is still existing. We still continue optimizing the body so that the problem does not come back.
Okay. There will be no reoccurrence of that.
Like I said, something you must have done wrong in the body, which has led to the problem.
Right.
Now we fix the problem. Now, if you bring back what has led to the problem can come back. So,
Right.
which means you fix the problem and you maintain it. That's very simple.
Right.
The do's and don'ts. You maintain the do's. It's fine. It will not come back.
Right. Thank you so much.
So, all right. Thank you, everyone. We hope this session helped to address some of the questions that you may have been struggling with, you know, and we hope we could provide you answers. So, thank you for joining in.
Thank you so much, Dr. Meera, for coordinating. We should all have Dr. Meera here in the picture.
Thank you
Uh,
so much, sir. And
so
thanks for
Dr.
thanks
Meera has
carrying
been
things around.
tirelessly communicating with everybody. We appreciate Dr. Meera, and we all.
Yeah, doctor, I'm thankful to Dr. Meera. She has insisted me, madam, you just go for that.
Yes.
And I'm really thankful to you and Dr. Ruchi and Dr. Meera also. Thank you so much.
Thank you. Thank you. We should be able
Yes,
to see Dr.
thank
Meera so that you know Dr. Meera is there, which is helping everybody.
Okay, I think
Thank
there's
you so much, sir. Thank
some
you,
issue
ma'am.
with the video. She's not able to turn on.
Okay.
Yeah. So,
Okay.
okay. Thank you, everyone. And yes, so you can stay connected with us. You can join our community where we keep sharing about our upcoming webinars, workshops, so that, whatever we have learned over the past few years, we try sharing it, through these webinars and workshops. So thank you, all of you.